Great. So this is Dr. Adam Gvili.
Sure.
Yeah, that's great. So I'm really looking forward to this. So let's just get straight into it. I think.
Sure.
Can you just explain a bit about what you do then?
Sure. So I'm a physiotherapist, as you know, in the States, right? I'm here in New York City. My specialty is male pelvic floor. I hope to treat females one day. I'd like to focus solely on males for now. I also treat orthopedically. I treat a lot of athletes. And of course, you're run-of-the-mill weekend warrior, right? I really enjoy treating kind of like full spectrum, right? The only population I don't treat is pediatrics. I think there are much better people out there that can focus on pediatrics than me. And that's pretty much it for now, right?
Right. Yeah. So do you focus when you say you treat men? Is it just to treat the pelvic pain or any sort of physiotherapy problem?
Yeah, good question. So I treat a lot of females for orthopedic issues. I won't treat them for pelvic floor, but obviously I'll treat men for any issue. So I treat for all issues.
Right. And this is based out of New York. You've got a clinic there?
Yeah, right in Manhattan. Yeah.
Right. Wow. How long have you had that for?
About 2 years now.
Right.
I think at some point I don't know if you know how much you know about me, but I myself went through a pelvic floor dysfunction back a couple years back, maybe 10 years ago or so. At the time, there was nobody out here to treat it, really, in terms of men treating men, right? There were females treating it, but having a conversation like, hey, you know when you pee at a urinal and you get this weird feeling, and I'm like, oh wait, you don't pee at a urinal, right? So like, there's no way we can relate on this topic. So I would get into like weird dead ends like that, and I couldn't complete the plan of care. Luckily, I did meet a woman who was really familiar with the male anatomy, and I give her a lot of kudos, and I did learn from her.
Right.
That's one of the reasons I started on my own, because I was like, there are no males treating males. And guys don't like to talk about their penises much, right? That's just the truth.
Yeah. So what was your experience of it then, of pelvic pain?
Yeah. So luckily I had some pain, like occasional shooting pain, maybe sometimes into the rectum. It would be maybe 2 seconds and go away. But mostly it was just a hypertonic pelvic floor. I had constipation issues, some ED, like a weird ED, premature ejaculation at times, and that was because like the muscle was so tight that it was constantly contracting on my prostate. So if you can think about that, right? It's like almost like a borderline persistent genital arousal disorder. And I remember my third physical therapy session, like it got better like that. We pushed the right buttons. I think that's what it was. So yeah. What
were you doing in the physiotherapy session for it to recover so quickly?
Yeah, so we didn't do much movement-based stuff, which I kind of think would have sped up the process. But what I did appreciate was that this certain individual did a lot of internal. And that's part of my practice as well. I do a lot of internal, kind of kick that taboo to the side, guys treating guys. I think at the end of the day, even with my orthopedic clients, you need that therapeutic touch to get that therapeutic effect, right? I need to tone down your system if that's the case. And most of my guys have a hypertonic pelvic floor. I treat mostly, on average, is 20 to 40, and you have the outliers. But I usually have to tone down the system first before trying to get you to engage or believe that this is going to work. Because by the time you've gotten to me, you've seen so many practitioners that have run you down some rabbit hole, right, of Googling and thinking that you have a terminal disease. So I have to calm you down a bit. And the way to do that is by internal and manual.
Yeah. So you said there you said that there was a taboo with men treating men. Do you find that in the US then?
Totally. And it's funny because when you speak to practitioners in the UK and Australia who are light years ahead of the US, right, in terms of like, we're practitioners and we're here to get people better, and that's our goal. It has nothing to do with gender or anything, right? But for some reason, when you speak to people coming out of school or people that might be interested in specialties and they hear what you do, they're like, oh, I could never do that, right? That's usually the answer that follows that. So yeah, you do get that a lot.
Wow. So, because I was under the impression, you know, obviously you've heard of a headache in the pelvis.
Yeah.
Well, that's all, yeah, that's all internal. Is it? Well, not all of it actually. No, that's wrong. But some of it's internal, isn't it? And that was, you know, that was created in the US. And I'm quite surprised that it's not just because it's such a big book within the physiotherapy world. I'm surprised it's not just common being accepted into the practice.
It's such a big what in the physiotherapy world?
It's such a known book that with it, I'm surprised that there's a bit of an issue around men treating men.
So it's interesting. I do give Dr. Wise and Anderson a huge kudos because they kind of got this whole movement started, if you really think about it, especially for males. And I've had the wand and I used it. I'm not the biggest fan of it.
Right.
But yeah, I mean, internal is out there, but for some reason it's still a taboo, right? Like when I took my first men's pelvic floor course with Herman and Wallace, I remember was it a 2 or 3 day course? Either way, we spent a good 2 hours or an hour and a half talking about what do you do in a situation where a guy gets an erection. So it was more geared towards women feeling comfortable treating men as opposed to just how do we diagnose and treat men. So you could see even within the female like kind of sector, there was a taboo here of like, oh, what do we do, right?
Right.
So I think you're going to get that on both ends of the spectrum.
Yeah. And then just before we go on with how you specifically what the treatment is, what name would you give to this? Because there's a lot of debate in the groups over what terminology people should use, but you know, coming from someone who's actually in the field, what would you call it?
Yeah, it's tricky, right? Because have you heard of sciatica?
Yeah, that's the nerve down the thigh. Is it something
the back, essentially by the back of the leg, right?
The back of the leg, yeah.
And sciatica, or it could be coming from your spine. It could be coming from anywhere along that pathway. It's similar to kind of like what pelvic pain is, right? We have an umbrella term, and then we kind of branch out from there. So I don't necessarily know if I would rename it because, again, it depends on someone's symptoms, and it depends on. This is a multifaceted issue. Like we don't really know what's going on. I think the biggest disservice we have done thus far, though, is diagnosing people with stuff we're not sure they have.
Right, such as an inflamed prostate.
What the hell does that even mean? Like, no, seriously. By the way, I'm a little more animated than your average physical therapist. But what the hell does that even mean? Like, I have leading urologists in New York City referring me clients, thankfully, right? And I'm very thankful for that. But how can I feel an inflamed prostate, right? You can't feel if it's boggy, you can feel, but can I really tell if it's inflamed? I've touched many prostates. I don't know if that's necessarily true, right? I'm being brutally honest. I could be wrong. Maybe I'm not feeling it, but I'm telling you what I think. Or, I mean, I have this theory that specifically in the US, I don't know how it is in the UK, but we over-medicalize here, right? We definitely over-medicalize. We diagnose. The reason why we have to diagnose is so we get paid through insurance.
I see, right, okay.
You never walk out of a doctor's office saying, well, we're not really sure what it is. Just do this and this. That doesn't happen. We're always looking for an answer for some reason. But how do we know it's necessarily the pelvic floor? How do we know it's a hip issue? How do we know it's not a low back issue? There's so many things that can cause said symptoms that I think we'd be doing someone a disservice to say it's for sure this, when we don't even have enough research on majority of those diagnoses that you've heard of.
Yeah, so it's more, I mean, Cole Monahan's mentioned this, but it's not, giving it a diagnosis can be a bit definitive and not really help the situation because, like you said, there's so many different symptoms coming from different places and it's hard to sort of classify it.
Totally. And then even then, like, right, I've had people who have had the one night stands that said that this happens after that. I've had people that have never had sex before and tell me they have these symptoms. So when that happened, the first time that person came to me and said, I'm actually a virgin, I've never had oral sex either, but I have these symptoms, that was like someone shot me in the head, because I was like, we've been taught to believe that this could potentially be something that changed like your urethral or bladder flora, right? Whoa, like you're right. So I'm always at a question mark. And I think that's the part that's exciting about treating male pelvic floor. Is that you're constantly problem solving.
So, I really want to ask, this internal treatment. You say you're not a massive fan of the wand. Is that the because there's a few different types? Is that like the easy wand or the magic wand? You know, it's like
it's kind of like an S shape.
Yeah, that's right. Yeah,
like a small S shape. I'm not the biggest fan because to go and search for trigger points, I don't know how helpful that is. Also, unless you're some sort of Marvel, DC comic character and you have a long arm where you can actually take it and put it into your, butt, then you might have a problem kind of relaxing certain muscles because you're utilizing them in order to contract into a certain position, right?
Yeah, exactly. Yeah.
With that being said, I'll never tell someone not to do something. In most cases, I won't say not to do something. So if that makes you feel better, do it, right?
So you're using the finger then, presumably?
Yeah.
Right.
We use gloves, right?
Yeah.
Go ahead.
Well, I was going to say, so you're using your finger like a wand, basically, or not? Yeah.
So, am I looking for trigger points or not? I've had people that don't have really that much tension in their pelvic floor, but they go through all the gamut of symptoms that everyone has who does have a high tone pelvic floor. So I'm not necessarily looking for trigger points, but something that says we're in the right area, right? Like, especially the first session, which is an evaluation, I'll go around and try different things. And I'll tell my client to text me the next 2 or 3 days. And then I'll have like a log, 2-3 days, another 2-3 days until they come in. And then we'll see, did that work? Okay, let's stick with that for a little bit. And then if we get kind of like to a point where we're stagnating, then maybe we'll switch to something else. Right.
Yeah. So what are they? Are you telling them to stretch, or do they do the massage themselves, the internal massage themselves? What is it? Just a combination of different methods that you?
Yeah, I mean, I don't have a cookie cutter treatment. If you take someone with a really high tone pelvic floor that kind of sits all day, that doesn't move much, they would do really well just kind of going out for a walk, starting slow, deep squat. Like my favorite actually is a deep squat in your bathtub. Like, I don't know if in the UK, if you have traditional bathtubs like you do here, I'm sure you do. Yeah. With kind of curved edges on the side.
Yeah.
So if you can deep squat with your back kind of supported, heels down, that curved edge will further push you into hip flexion. So what you'll get is an opening of that perineum and adductor fascia. That's my favorite one to tell kind of almost everyone on their first visit, just to see if we get a change, because that's what we're looking for, right? Can we an active change?
It's funny you should say that, because that is the position that I would do a wand in. That's the exact position and that really helpful. That deep squat, it just pulls everything open. You can feel like just like release and come open. So that's I can certainly associate with that. But
what are they like now? How long have you been kind of going through what you've been going through?
I've had it since 2011, and it's mainly been like a twisted urethra feeling in halfway down my penis. It feels like it's twisted, and that there's something in it. There's not, because I've had MRIs and ultrasounds and everything, and every test, and there's nothing there. There's nothing visibly blocking it. but that's the main one. And that kind of marries up with the split stream. I only ever have really a split stream. So what that says to me is that there's something in the urethra or the bladder sphincter. It's so tight that it's causing me this urgency and pain.
Sure. Are you still getting pain?
Yeah. But that comes on when I need to go to the toilet. So when I go to the toilet, the pain goes, and then it just starts again, and it starts to build up again until I need. I get these like electric shocks up my back passage around my prostate. It's like they're like electric shocks. That's it, right up my back passage around my prostate, which, you know, that's why I'm still more on the fence about if it is to do with the prostate or not, because a lot of my pain does come, it feels like it does come from the prostate. I know a lot of other people in the group say there's no pain anywhere near the prostate, but for me, it's either the prostate or halfway down the penis. So, okay. That's been my experience. But what I wanted to ask is that when we talked on Facebook, that you said that you looked at every facet of the person's well-being, and I just wondered how important it is to like look at a person's habits, their mindset, that just everything, treating this.
Yeah, I think that's probably the most important piece of the puzzle, right? And I don't know if you could relate, but generally up until you get to that point, right, you have seen other medical professionals, you have read other blogs, untraditional sources online on Reddit or perhaps another site, right? Because we're looking for that golden nugget, essentially, right? So you're not going to go to, I don't know what the equivalent is in the UK, WebMD or any of these sites that might give you an answer. You're going to look for that one dude who was on a blog in 2014 who said he saw some guy in India who gave him a shot of this stuff and he's cured, right? Or a lot of people are going to, is it Croatia or was it somewhere in Russia for these like old school antibacterias? I don't know.
Oh, I think it's is it Georgia? I've heard of that.
Georgia, that's what it is.
Georgia, yeah.
I'm not saying that can't work. I'm just saying that up until that point, this person has read so much and have heard so much, especially from the uneducated. And I don't mean uneducated in a condescending way, purely just they've never been faced with this type of stuff. So you take a urologist or a general practitioner, quickly, guy goes to a general practitioner says, let's go to the urologist. Urologist then, if he's educated, says, well, let's do some tests, rule out the medical diagnosis, and perhaps we might tell you go to a pelvic floor physio. But if not, these people are on 6 months of harsh antibiotics, as we know. You can be floxed, right? Is that the term?
Floxed, that's a good one. No, I haven't heard of that, but yeah, that's what you call it, yeah.
There's a lot of research to show that antibiotic sucks, right? Cipro. Then you have the cystoscopies, which also is weird as hell, right? There's something going on. Not comfortable, right?
No.
No. So what else we got? So yeah, and up until they got to you, they've had the run of the mill, right? So I think when they come in, the first thing that I do, I spend sometimes a half hour, 40 minutes just talking to these guys. I'm like, look, what's going on? Yeah. Some of them really do talk, and others kind of like, I'm getting like this pain somewhere. I'm like, look, let's stop there. If there's anything you want to tell me, if you want to tell me how far you ejaculate, this is all cool. This is a safe space. I was there. I felt all these symptoms, and nobody wanted to hear me out. I'm here to hear you out. So if there's anything that you're comfortable telling me, I'm here to listen. And usually from right there, they open up, right? Because I'm just a dude that had this, and I'm sharing this with you. And I think, and I use layman's terms, right? I'm not giving you medical terms when I speak to you. So I think it's important to meet the person at like same eye level, right? To show that you're empathetic, to show that you care, that you actually give a shit. Excuse my French. Right?
Yeah. How important do you think that is then for a guy? I mean, it's, I don't know why, but it's not been as difficult for me to sort of tell either a urologist or physiotherapist about it, or maybe friends and family. I haven't really felt that guarded about it, but I can understand a lot of men, particularly young men, who they're just landed with this, them being quite embarrassed to really open up about it. But do you find that is actually therapeutic for them to say, oh, I've got all these symptoms?
I think when they've gotten to a point where they feel like they haven't been heard.
Yeah.
Yes.
Yeah.
Think about how long you've been in your head, right? Think about how many times as a man you've gone down the street, just crossing the street, thinking, well, I bet you that guy doesn't have what I have. I bet you he doesn't feel what I feel. And you start to play these scenarios in your head that are so irrational, meaning I went to a wedding. I remember it was last year. Haven't seen a friend of mine since high school. And I told him what I do. And he goes, wait, now that you say it, I kind of do get some pain down there. Yeah. And I'm like, holy, that's crazy. How many people actually go through this and don't talk about it, right?
Yeah, exactly. Yeah. Well, one of the admins of the group, Lloyd, who's the admin of Prostatitis, he was saying that he was he's a barber, and he was saying that one of his clients had heard what he did, what Lloyd did, which is be the admin of this group, and said, "Oh yeah, I get pain in my testicles. I haven't been to the doctor about it. I just I've just got it," and just never assuming that like other guys, like I've got these pains and whatever discomfort in the pelvic area. But you're right, when it's just you obsess about it yourself, you know. But so how important do you think it is, sort of, this is the other thing you mentioned on the on our chat on Facebook. You said that using the right word when you're speaking to these sufferers, you don't, just explain that, what you mean by that. You're saying that you said that you use the word client and not patient.
Correct.
That's important.
Yeah, patient just kind of like indicates that they're sick, right? Even my office looks nothing medical, right? Like it's kind of black, it's kind of modern. I don't have white sterile walls. I think that's very important, right? At the end of the day, someone's coming to get treatment, but they're also coming to hang out with you for 45 minutes to an hour. And in that case, the verbiage you use, like if you keep saying the word chronic, they're going to really think that this is going to be chronic. Yeah. Right? Keep calling chronic prostatitis, and then you look up what chronic means. Chronic literally means, I remember when I was when I got my doctorate, I remember learning this, it was like acute. And then if you go to acute, it's like a certain amount of days, and then it turns into chronic, which is like 3 months and up. And there's nothing past that. It's just 3 months for the rest of your life, right? So it's really important to use words like, you want to empower the client. You want to let them know that there is a light at the end of the tunnel. Yeah. And you want to let them know that if the control is all in their hands, I'm not going to know when they get better. I might feel tissue and tell them this feels better, but you're going to know when you get better because you have the symptoms, right?
Right.
So once symptoms start to dissipate, you'll be like, oh, well, Dr. Adam, it's working. Right? I'm empowering you to make that decision, and I'm letting you know that you may have seen 4 or 5 other physical therapists. I'm not sure what they did. There are many great physical therapists out there, but I know my method and how I want to do it. So I never speak in words of like, this is not going to work. Let's just try it. Let's see how it goes. And you feel works. A lot of the guys, and this is the last thing I'll say, a lot of the guys have been told, don't run, don't lift weights, don't do anything. They ask me, is that okay? Should I not be doing that? I tell them the opposite. I tell them, do everything you want to do so that you can kind of get back to a life you want to live. Within treatment.
Yeah. So does that include, what might slightly off topic, what about sex then and masturbation? How do you think that factors into it?
Great question. So I'm not against sex at all. I actually had one client who told me prior to this, he used to have sex like 7 to 8 times a day. I told him, I don't know where you get the stamina. I'm not like, I don't even know, but kudos to you. And now he's down to like 3. I actually told him to get out of my office at one point as a joke. I was like, 3 days, that's pretty good. But I think sex and masturbation is different. For some reason, I feel like when you masturbate, you get a much stronger contraction in the pelvic floor.
Yeah, I totally agree with that. Yeah.
And I'm not sure, I haven't looked at the evidence for that, I'll be honest, but that's kind of like my intuition. Also, you're getting a lot more sensory feedback, right? When you're using your hand, because your brain and your hand can communicate on what you like, versus when you're entering someone, you don't really have control over your environment. So I usually tell people, especially if the guy's masturbating a few times a day, tone it back a bit.
Right.
And if it's causing, like, do it, but if it's causing you symptoms, then we'll have to rethink it.
Yeah, I mean, yeah, and so I think one of the more traditional approaches by urologists in the UK was to tell men to just that ejaculation is good, and that the more, because it's cleaning the prostate out. But you do see a lot of anecdotal evidence from men saying that, well, when I masturbate, there's just more tension, and that it's actually just continuing the cycle of being in spasm almost, and it needs a break.
Irritating the prostate, or is it just that the muscles themselves are so hypertonic that it's causing it to spasm? Right? It might be cleaning the prostate. I think there's actually evidence to show that it does, but it makes you worse because you have a pelvic floor dysfunction, right?
Yeah.
It's a double-edged sword.
Yeah, and you get a lot of, I've heard a lot of men say that edging, which is, for those who don't know, that it's, delaying ejaculation continually is not good for the prostate, because it's building up that tension. And some men swear that that's how they've got it. That, but again, I don't know what the studies are for that. But so, do you think that there's a general type amongst the men that you see that have got hypertonic muscles, and they're generally anxious and they're obsessive types?
Yeah, put it this way. I've never had someone who was like really obese or kind of laid back. I've never had a stoner come in here and say like, dude, my pelvic floor is way off. That's never happened. Right? It's always been like your Wall Street, like, F yeah, we're gonna get this done, like, type of guy. Right. And I'm very much that guy. I'm high strung. So it's never been that type of person, especially those who live in New York City, because you live here, whether you're a type B or type A, it's going to turn you into a type A person. So right. That's the people I've always engaged with.
Right.
But there is that correlation with people who tend to be higher strung.
Yeah. And sort of, what's out of all the people that you treat, how many go on to sort of not have pain?
So interestingly enough, those that have pain, 8 out of 10 times, I've usually gotten the pain down to 1 or 0 on the pain scale within a few sessions. But then it's sort of like this residual, like, tightness effect, or like a burning in the urethra, which is different than pain, right? Like, it's just a constant burn. And most people say they can live with that if that was their only symptom. Yeah. But the pain is actually, for some reason, easy to get rid of. Right. And I think it's the most important to get people out of that pain cycle, right?
Right.
They can believe that this is possible.
Yeah.
And get them on their way.
Yeah. And do you think that there is a place for medicine? A lot of talking about pain. What do you think about the high-powered painkillers like tramadol and codeine and that sort of stuff to treat it?
What do you think about them?
I took all that when I first got it. I took them all at the same time, which probably wasn't the best approach, but it didn't do anything for me, for my pain, nothing at all. So it sort of ties into this question I want to ask you about the most misleading treatments, but generally, do you find any medicine has a beneficiary, effect?
Generally, no. And the medicine, and again, I'm not giving medical advice here. I'm not saying whoever's listening to go against your physician's wishes. I think it's really important to have a team, kind of like a plan of how we're going to take care of this. But with that being said, the Valiums, the suppositories, the gabapentins, the Neurontins, the nortriptylines, amitriptylines, these are all Band-Aids that I think delay what you're going to feel, right? What I usually hear is, well, I took this and there was the absence of pain, but kind of when it wore off, it was 10 times worse.
Yeah.
Like, it's not that it's worse. It's that you felt the absence of pain and therefore your brain now feels pain. So there's no, like the delta in between is like massive. If you think about that, right? No pain.
Yeah.
And when you haven't been on it, it was kind of like residually painful. So that's important to note if anyone is on medication, right? That happens.
Right. And so, and what do you think about things like antibiotics? And obviously, you said at the start about being floxed, but do you think that's bacterial element to it? It's just so rare that it's not even worth considering.
I can't say that. I'm not a medical doctor.
Right.
We do take some pharmacology, but I don't think that's within my scope to say. But you do hear a lot of stories where sometimes it has a negative effect on the individual.
Yeah. Well, long-term negative effect sometimes, especially with ciprofloxacin. I've heard all sorts of horror stories with that.
Achilles tears, I think, something like that. And the fact that it changes, I think, the collagen in your tendons or ligaments. I think tendons. So that's a big deal, right? Especially if you're an active individual.
Yeah, exactly. Yeah. So what sort of what would you recommend to young men who have just got this? What do you think the approach, the route should be?
I'm trying to think if I can do it all over again, right? Because I was a young guy when I had it, 18, 19. What's the approach? It's difficult because I think we as a community, right? This is now a community that, right? We have to educate the medical community. That's usually kind of like the gateway to how people get or learn about this issue. But for young men that go into this, I think the best way to do it is, Google online, go on your Reddit, look at this stuff and make your informed decision. Again, that's a double-edged sword because you're seeing all the information, you don't know how to process it. Yeah. So, but I know so many people that found me through untraditional sources, and I was the way they kind of got treatment. They didn't see anyone else. And their prognosis is usually better than someone else's.
Yeah.
They haven't been floxed in a way,
Yeah. No, I think, some of the other physiotherapists that I spoke to said that it's important that they do go through a GP or a family doctor, because if it is anything, quite sinister or serious, then they will get that screening from a urologist. And, it's just sort of the balances and checks are all there right at the start. And then really, though, a urologist should be saying after that, maybe go to a physiotherapist. But I think a lot of young men just get in a loop of urologists without going past that and then just giving up.
Right. So what I get sometimes is someone might come see me, and then I'll almost always refer out to a urologist, colorectal specialist, depending on the issue, just to make sure that they're medically cleared. and that I can maybe see some labs and maybe get a better understanding of what might be going on. And of course, liability issue, of course, right? So,
right. Yeah. And this is quite a big question, but what do you think is the cause of it?
wow, what a loaded question. What do I think the cause of it? That's impossible to say because, I mean, if you go on my website, you'll see all the diagnoses that we treat, and there's like probably 100 more. But it's multifaceted. There's no way to tell, right? I mean, most of the guys I see have a hypertonic pelvic floor. What's that due to? Who knows? You know how many times in an evaluation I've heard, I kind of just woke up with this.
Yeah. Wow. Right. Okay. Yeah.
So like, okay, but what happened around that time that you woke up with it? I don't know. Sometimes they have a stressful scenario around that time frame, or they had sex with somebody, or there's no two situations that are really the same.
No.
Because you're not going to get the same human being in two different situations.
No. Yeah, one lad told me that he just rolled over one day in bed and it came on.
We'll make sense of that from a medical standpoint, right?
Yeah, exactly. Yeah. What? Yesterday I posted this spousal revenge syndrome article, which it was slightly facetious, although there might be an element of what's the word fact in it, perhaps the guilt people feel over cheating on their wives. But what do you think about that?
So when you posted that, I was like, wow, I've had this thought in my head for the longest time. So I remember treating someone who said that they've always had premature ejaculation with their significant other, always, ever since they got married. So I asked him, prior to that, did you ever have premature ejaculation? And he said, no. I was like, let me ask you a question. Was your wife a virgin when you guys met? And he's like, what? I'm like, did your wife have intercourse prior to that? And he said, no. He goes, I was her first. So I have this feeling that there's a correlation between that, because I've seen that more than once, and the cheating spouse or cheating boyfriend or cheating girlfriend, whatever it is. Because as you said, it's like a guilt, right? Yeah. What happens during an intercourse with a virgin, right? There's pain, there's a process to it, there's apprehension, there's slowing down. There could be tears, right? There's a feeling of guilt that you might be hurting this person. So does that have something to do with anything or not? Question mark, right? That's a possibility. I did read that article that you posted, right? The spousal revenge. Yeah. I think from a psychology standpoint, what they're trying to do is say, well, in the absence of medical positive findings, we are coming to conclude that this is fully a psychological issue, and therefore this is called spousal revenge syndrome. Which is cool from a psychological point. I guess you're making a good point, but I think they're saying because of the absence of positive findings, this is why it could be this. So it's important to note that.
Yeah. It's interesting when you said that about virgins getting this. I find that just for me, it's so locked into sex that I don't know why. Maybe I don't know why I've got that in my head, but just for it to just occur in a virgin, it seems so what's the word, like unpredictable. I don't know, because Carl Monahan was saying that a lot of young guys, if they're having a lot of sex and they're quite sexually active, and obviously it's a sensitive area, and depending on how aggressive they are and the positions and how much. How much rest time they're giving themselves. You could see that there might be a link between the two, but sure. just happening in a guy which isn't sexually active. I find I'm not denying it. I find that
it's just very difficult to find. I think I've only seen like 3 people that said they've never engaged in sexual activity and they have this issue. So yeah, could there be trauma associated with it from a different point of view? Yeah. If it masturbates too hard or whatever it may be.
Yeah.
But I always thought it may have been like this super STD bug that we just haven't found yet.
Yeah.
And again, from a medical standpoint, that's out of my scope. That's just a theory of mine. And when I speak to like leading urologists in this country, they're like, that's not a possibility. And I don't know how they could say it's for sure, it's a definite, that it's not a possibility if there's always something you could find, right? So that's the tricky part.
Yeah. So, they're so confident that it's not like a super bug STI. They just, why not?
I don't know. For the ones that I spoke to, I think I don't know. I didn't really get a good answer. I think one of the physicians said we would have found it a long time ago if this was the case.
Yeah.
We know that antibiotics only fight off certain antibiotics fight off certain bacteria, right? We know that. Did you have a semen test?
No.
Okay, so I had a semen test, right? It's where they take a culture of your semen. And I think I had Enterococcus faecalis in my semen, which is a bacteria I think that's found mostly in your colon. That's interesting. Is there like a leaky prostate, kind of like there is a leaky gut? I think that's a possibility, and I think there's a physician in India. I could send you the YouTube video that explains that very well.
Right.
But then I also read in some studies that Enterococcus faecalis is actually normal to be found in some semen cultures. And obviously I have two kids, right? Like I thought I wasn't able to have kids. So again, another question mark. So go figure it out.
Yeah. It seems like the more that you investigate, obviously the more questions it just throws up.
Sometimes I wish I knew nothing.
Well, just moving on then to like awareness. What sort of awareness is there in the US of it? I mean, here we've got Prostate Cancer UK. Although it obviously focuses on cancer, it does have a prostatitis area of the website, and I've been told by some of the specialist nurses there that they are getting more and more calls from men inquiring about prostatitis. But I don't know of many organizations that are focusing on this. What's it like in the US?
Yeah, I mean, pelvic floor therapy I think is growing rapidly year to year, and I think we're starting to get men interested in treating men. I'm not aware of many organizations that actually are catering to prostatitis sufferers or chronic prostatitis. Yeah. I hope to one day start that. I'm currently in the process of starting. Well, I've already started. It's Pelvis NYC, which is the go-to center for pelvic floor in New York City, especially for treating males. And hopefully start to build a community around that where we can help support men of all ages from all around the country to get help and talk about their issues.
Yeah. Do you find it it's important then for men to just be able to feel more comfortable talking openly about it?
Yeah, I think it's getting a lot easier, especially with there's a company called Roman here, where the individual had ED as a young male, and he went to his father, who I believe is a cardiologist, and they fixed something in his heart, and essentially his ED went back to normal. So he wanted to make it aware. His erection went back to normal. So I think he wanted to make it aware that young men go through erection issues, and it's okay. And now you can get Cialis, Viagra. I think you still need a prescription, but you can order it online, which is revolutionary. And young men are taking it when needed. So that also started a conversation. That's on a national scale. Yeah.
And just for those young men out there that have this, what is or they're thinking about, what to do next. A lot of them ask me, what should I do immediately? What can I do that is going to help me right now? And do you think there's anything that can be done, or do you think that people have to accept that this might be, 6, 12, 18 months?
It doesn't have to be that dark. I think first off, find yourself a good urologist, someone that you've heard may have treated this stuff. Find yourself a good pelvic floor physio. Maybe even do a telehealth consult to get some of your worries, out in the open, right? Like, what are you really worried about? In 99% of these cases, I believe it's not terminal, right? Like, that's usually the biggest scary part is, am I going to have this forever? Is this going to kill me? Is this prostate cancer? Am I going to be able to have kids? Am I going to be able to have sex? Is this going to affect function? So if you start to answer all those questions, that already can start to tone someone down.
Yeah.
Is there a stretch? Diaphragmatic breathing always helps.
Right.
It increases vagal tone, right? Increases parasympathetic activity so that you can kind of lower your blood pressure, lower your heart rate. And there are many stretches online that you can find to help and see what works for you, it's really simple. If you haven't been moving, start moving. Start to do things that feel good. And the worst thing you could do is limit yourself to say, well, I was told not to do this because this might cause that. Keep yourself informed and know that movement is, in general, medicine.
Yeah. And what about nutrition-wise? What about like alcohol, spicy food, things like that? What's your thoughts on that?
If you saw the amount of spicy food I ate, like I love spicy foods. In general, I'm not a big fan of alcohol, but these we know are bladder irritants, right? So keep those at a minimum. But at the same time, we're all human. We're all trying to enjoy living, right? So, it's funny because I remember when I first started treating this, I was like, the literature says do not drink any alcohol. Don't do anything. Stay home, right? And the truth is, you're going to want to go to the pub and drink a few pints with your friends. That's going to make you a happier person. That in itself, right, if you're not doing it excessively, is going to increase quality of life. So who am I to tell you to stop that, right? I think everything in moderation is important.
Yeah. I think that the approach is, I like this kind of a bit more relaxed, fluid approach, because I know that my urologist was quite, I know you're a physiotherapist, but my urologist was quite strict in what I could and couldn't do. And for me, that just made it worse. That made it feel like, I couldn't really relax and enjoy life, like you said, because I would make it worse. And then that kind of plays on your mind more and more that, this is affecting my quality of life. Whereas, I think just got to relax. That's kind of like what I keep trying to tell myself, but I don't know.
And it's difficult, right? Because this is causing you anxiety.
Yeah.
Your anxiety is causing you anxiety. Yeah. And it's like this feedback loop that's totally fucking you up, right? You're like, oh my God, what's going on here? Like, what came first, the chicken or the egg? We don't know, right? In general, this is going to make anyone anxious, right? This is going to make any guy question his masculinity and question what's wrong with him. What did he do to get to this point? What he could have done prior to not, right? And these are all irrational scenarios. This isn't Back to the Future where you can go back in time and not do that thing that you think caused this. Stop with those things and going forward, try and do everything you can to get better.
Yeah. No, that's great. I really enjoyed the chat. I've not got any more questions. But what's your? Are you getting more and more? Do you find that you're getting more and more men asking about this and coming to you?
For sure. Yeah. And I love when they first come in and they're like apprehensive a bit, and then they're like, "So is it okay to talk about, like my erection?" I'm like, dude, it's totally fine, right? Like, I'm a straight male, and it wouldn't matter either way. I'm just saying, I'm trying to change that taboo to say, like, let's talk about anything, right? We're guys. Right. And more males, I think, are starting to see that it's okay to talk about this, right? This isn't like the 1950s where like sex in general or genitalia in general is like taboo. I think we're starting to get a little more comfortable with it. And fortunately, people are starting to talk about it more. and men in general are like really fragile. Like, I don't know if you've ever heard the term like "don't be a vagina." Like, don't be a penis should be because like guys are very very fragile if you think about it. I know women both have been through breast cancer and raising like 23 children on their own, but guys we're incredibly fragile. So I think it's important that we create a community and create a space for these guys to talk and feel heard.
Yeah, brilliant. That's brilliant. Well, no, thank you very much, Dr. Adam. You said that your patients call you, your clients say Dr. Adam.
Sure, whatever, or Adam, whatever.
Or Adam.
Yeah. And I want to talk about, by the way, any of your symptoms or anything that I can do to help. Shoot me another, message. We'll Zoom again. We could talk about that and kind of like problem solve.
Well, no, that would be great on a personal level. Yeah. But thanks a lot for your time.
My pleasure.
Thank you very much.
I enjoyed this conversation a lot.
Thank you. Thanks. Thank you. Cheers.